Good morning, everyone, or afternoon for those on the East Coast, and welcome and thank you for joining us today. My name is Jennifer Miller, and I serve as a principal within our healthcare practice here at Huron. We recognize that the coronavirus has really created the immediate need to shift care delivery, leverage digital platforms differently, lead the workforce differently, and really today we want to start to look forward and share perspective on how these short-term shifts can really create some long-term change within your organization. As we get started, I'm going to help facilitate the call today. So I want to kick off with just a couple logistical points. So during about the last 10 minutes of the call, our panel is really excited to take questions from all of you who are attending. So you will be able to submit questions throughout the webinar by clicking the Q&A button that you can kind of see circled here on the left on your screen throughout today's session, and we'll get to as many of those as we can. There are also a couple times where we'll look to engage you and hear your perspective and feedback. So some open-ended questions, we'll ask you to share your perspective through the chat feature. So that's the function you see circled kind of on the right-hand side of your screen. And we'll also incorporate one poll throughout the conversation. So just so we have a chance to hear from you as we walk through the conversation today. So during our session today, our panel is going to share perspective on how crisis can create transformational change, really discuss how organizations can focus on aligning resources and capacity with consumer demand, address shifts in consumer behavior, and ultimately create a long-term competitive advantage. So now let me talk a little bit about the amazing group of panelists we have with us today. So to start, Andy Waldak serves as a senior partner with Insight, and over the last decade has partnered with numerous healthcare organizations, as well as Fortune 500 companies to focus on developing long-term strategies to drive transformation and growth. Diane Caragori really brings deep expertise and experience in the healthcare industry as both a clinician, nurse leader, and consultant, where she is focused on performance improvement and strategic change in areas of clinical delivery transformation, clinical variation reductive, and perioperative nursing, to name a few. Annie Zilius has assisted numerous healthcare clients in driving performance improvements related to access to care, clinic and physician operations, and service line design throughout her career. She is a subject matter expert in ambulatory patient access and scheduling solutions, among other topics. And finally, Andy Schramm has focused his career on implementing performance improvement programs across a broad spectrum of healthcare, life science, and manufacturing organizations. His areas of expertise include workforce management, supply chain, and process improvement programs that drive margin improvement. So now let me turn the discussion over to Andy Waldak to start the conversation and facilitate conversation with the rest of the panelists as well. Andy.
Thanks, Jennifer. So what we wanted to start with was a little bit of a historical perspective. So we look back at other what we call big events, whether that be the terrorist attacks of 9/11, past recessions, even past pandemics. When you look back across history, we think there are 4 principles that are useful for leaders to understand as you are plotting your course for how to navigate some of the near-term uncertainty, but also, as Jennifer described, how do you really take advantage of the opportunity to accelerate transformational change? So we'll start with the first principle, and the first principle is that there really is a silver lining. As taxing, as stressful, as hard as COVID-19 has been on everyone, when you look back at big events, they tend to create opportunities that lead to incredible growth. And the reason that they do that is, number one, big events cause experimentation for people. Think about all the things that you are doing differently in the course of your daily life today. Heightened experimentation is the key element that then creates the opportunity for people to take on new offerings and be open to new experiences. The other piece is the challenging conditions force organizations to be more focused. So it creates greater emphasis on what is it that people really want? How do I create a product, a service, and experience that will be responsive to their needs? And the results of that are things like Airbnb, Dropbox, and Square. Those are all large, successful organizations that were birthed in the financial crisis of 2008. Airbnb was catering to millennials who, number one, couldn't afford to stay in hotels and were looking for a differentiated experience. Square was an answer to small businesses who couldn't get financing, but also were skeptical of large financial institutions at that time. This phenomenon doesn't just talk about startup opportunities. You also see large organizations making tremendous change. The whole backbone of McDonald's is based upon the speedy service system, which was created coming out of the recession of World War II. The challenge McDonald's had at the time where there just weren't enough good cooks available. So they had to create a manufacturing process that was built around upskilling less skilled chefs that would enable them to deliver high quality, consistent food. That innovation then powered the next 80 years of growth for that organization. And so the implication for all of you, as you start to turn back on elective procedures, we start to evolve out of crisis response, is taking a growth orientation to those questions. Turning on elective procedures is the ultimate jump ball opportunity. So the question for you is, what is it that you're doing to differentiate effectively your storefront from your competitor's storefront down the street? The second principle we'll talk about is the idea that recovery is an important phase, but recovery as a focus is insufficient, because what recovery connotes is that we are going to recover and return back to the way that things were before. The reality is we know for certain that things will not go back to how they were. They may be substantially similar to how things used to be, like you saw in the UK after there was a strike with the underground. And what happened over the period of 3 or 4 weeks is consumers figured out new ways to get to work. Now, when that strike abated, the vast majority of volume went back to kind of previous travel habits, but you did see a change in behavior of probably 5 to 8% of the population, relatively minor, as opposed to think about the airport experience that we had post 9/11, a significant, meaningful, and demonstrable change in behavior. And so that's why, as we think about the plan and the advice for organizations who are trying to navigate coming out of COVID-19, recovery is an important element, but you also need to think about reposition. How do I drive near-term resilience given the assets and capabilities that I have? And also, how do I use this as an opportunity to fundamentally redesign? How do I put my institution on a different path that leads to long-term sustainability and success? So key lesson is recovery is insufficient because behavior, in fact, changes coming out of big events. And this leads us to our first poll question for you all in the audience, which is, we're curious to hear, what behavior changes have you seen? Those changes could be changes in the nature of how you work, what you're seeing across your colleagues and your associates. It could be what you're seeing with your patients and your consumers. And so the question is posed to you in the chat. If you could write in your responses, and we'll share some of those, and then we'll move on to the third and the fourth principle around big events. So some of the themes that are already emerging, not surprising, virtual care and the explosion in usage and adoption that we're seeing across the nation. The other one is the change in workforce. All of us have taught all of our employees, almost all of our employees, to work from home over the course of this crisis. We're seeing a reliance on scenario planning, right? We're talking about a very uncertain environment. Nobody has the precision around their forecasts. Andy and my colleagues will talk about how to make planning decisions in a period of heightened uncertainty. Others of you are talking about accelerating new care delivery models, a greater focus and attention on health disparities, an expansion of the services that you're actually, in fact, offering to your local communities. The change in consumer behavior about people's fears about coming to hospitals, that these are hot spots and that people want to stay away in some cases leading to quite negative outcomes. And so there's a long list of submissions from folks, and we appreciate your ideas. But I think it's safe to say that this period is driving a great deal of experimentation and a great deal of new behaviors, which then drives the third principle here, which is you all, quite frankly, have a choice. So everyone, their sister and their brother, has an opinion about whether or not a certain changed behavior will be permanent or will it be temporary. And that is in many cases, an unanswerable question. Because what we don't know is, are organizations going to respond in ways that reinforce and encourage those behaviors to stick over time? So what do big events do? Number one, big events change the environment that you're in, right? It rearranges your priorities and your goals. If we polled all of you, we are quite certain that safety for you and your family would be much higher than it was pre-COVID, right? It shifts the circumstances that you're in. We all have to deal with being quarantined and social distancing. And as I said previously, it encourages higher levels of experimentation. This then substantially influences the needs that we have as human beings. We call these jobs to be done, and it's a way to express what's the problem that really matters. What is it we're trying to solve in our day in, day out lives? And all of the dislocation that a crisis creates causes a repositioning and a reprioritization of what jobs matter to us, right? We're more focused on safety. We're paying attention to contamination types of issues. It may cause us to try new solutions, back to experimentation. Some of you, I'm sure, have changed daily habits, started new fitness routines, tried to pick up new hobbies. All of these are in response to a change in the environment. And so the choice you then have as an institution is, what role do you want to play in trying to intervene and influence behavior to stick long term? What are you seeing in the environment, and do you want those things to stick long term? Do we like the fact that our workforces now know how to work remotely? Do we like the fact that our patients and our consumers are learning that the digital front door can actually be a really attractive access mechanism? And so you have a choice. You can watch and see what happens, or you can innovate, pick certain behaviors, and then innovate behind them to try to influence and encourage the behaviors that are positive to your long-term direction to stick longer term. The last principle we'll talk about relates to the reality that all of this environment creates an unfreezing and an increased period of experimentation. It causes us to relax our daily habits. And as a result, what that means is that we can make quite substantial and meaningful change. This is a time to consider bold moves to accelerate your strategy and your transformation. Our friends out on the West Coast, Adventist Health, they, for a long time, have had grand plans in virtual care, including hospital and home services like those provided by Medically Home. And they made the decision in the crisis to actually substantially accelerate their adoption of virtual hospital. They announced on May 11th that they put their first 2 patients in their virtual hospital that was powered by Medically Home. And so here's an example of an organization who had virtual hospital on their long-term roadmap, and they saw this as a unique opportunity to make a bold move and substantially accelerate the adoption of that model, pulling something that would have been 5 or further years down the road and making it a priority and implementing it in this time of crisis. So this takes us then to the next question that we had for you. And again, it's in the chat feature, which is, what bold moves are you considering, and or what bold moves have you already started to make? So some of you are talking about you do want to move boldly in telehealth, right? How do you really accelerate the integration of digital and analog to substantially change how and where you deliver care? Some of you are thinking about real estate. And do I need all the square footage that I have previously now that my model has changed? Some of you are talking about shifting, in fact, your business model. How do you support elements like distance learning and virtual programs? Interesting commentary talking about taking virtual and expanding it to places like other specialties. So evolving out of, kind of family medicine, primary care, and taking it to certain specialties, integrating in with areas where you wouldn't traditionally think about it. Question about work practices and how much travel is actually required within our system and also external to the system as well. And so, as you can see, just from some of these topics, it is, while it's an incredibly challenging time, it's also an incredibly exciting time, right? And thinking hard about, we can't have multiple bold moves, but one or two big things that you should be thinking about to resource to really accelerate and leapfrog your strategy. So if we go to the next page, this just sums up the conversation we've had. So 4 key principles. First one is there is a silver lining, right? The implication is it's important to have a growth mindset. Even while you are still scrambling, you are rapidly responding to the crisis, thinking about what is it that I can do to differentiate my offerings in both the near, medium, and long term are a key to success. The second one is behaviors change. So we're not recovering to get back to where we were. We're thinking about how do we reposition the institution and ultimately how do we redesign it to drive greater long-term sustainability. To do that, I have to make some choices. I have to be able to observe behaviors and pick the behaviors that I want to then innovate behind to try to influence what new behaviors actually stick with people long-term. And then as we just talked about, this is a time that does reward those for making moves that are significant and bold. So what are the 1, 2, or 3 options that you have, making a call and then executing on those ideas and concepts. So on the next page, we'll then talk about how do you start to put that into practice. So on the next slide, we show a hypothetical curve. All of you are in different geographies. You all have different curves. They might have multiple waves. These pictures are still emerging on a day in, day out basis. That being said, part of what's already been put in place are your rapid response strategies, governance, and mechanisms, right? You've gone into crisis response mode, you put in place your crisis command centers, and you're navigating what you're experiencing. And you are now starting to step into recovery. I'm starting to turn the lights back on in parts of the system. That's an important track of work. But what we want to also have happen is simultaneous to that, creating dedicated resources that are also then thinking about the questions of reposition and redesign. And reposition is the idea of how do I drive and what changes do I make to drive near-term resiliency, and redesign are where some of our bold moves come into play. How do I redesign the overall system for long-term sustainability? Where that takes you to on the next page is then a pretty exhaustive list of issues to sort through. This page is in a little bit of an eye chart, which we apologize, but what we're trying to represent here is the need to think from the front of the institution, right? What are our goals? What are we trying to accomplish? What are we seeing in the market? How do we respond accordingly? All the way through the services that we are delivering, our capabilities to deliver on those, thinking through in a reposition world, how do I maximize what I have today, right? How do I think about my access strategy? How do I clear my backlog as fast as I can? If I'm trying to drive systemness, can I use that as a mechanism to simultaneously drive systemness? What are the set of emerging capability gaps? Now that I've dramatically ramped up telehealth, there are pieces that are falling out of that, right? There are gaps that we're seeing. So how do I address and close some of those gaps? There's a tremendous amount of questions around workforce and people. How do I create an environment that my people believe is safe? How do I create an environment that is inspiring for them? What is my new labor model accordingly? On the redesign side of the page, you've got bigger questions. What role do I want to play in my community? Many of you are going to have to wrestle with how far into public health do you want to evolve? You've already been pulled into that. Is that something you want to have be permanent, or do you want to react differently? how do you think about the integration of digital and analog to reinvent how care is delivered, and in some cases, reinvent even the nature of the care you're delivering? Many of you will wrestle over time with what really is the new economic model. As certain volumes come back, certain volumes don't come back at all, you'll be thinking about your portfolio composition, your source of margin, your cost structure. How does all those pieces need to evolve over time? And then lastly, how are you reimagining the environment? And all of this is supported by your people strategy, your operating model, how you're structured, how work happens, and your path and leadership through change in these difficult times. So with that, I want to transition and bring my colleagues into the conversation. We're going to have a half an hour interactive dialogue amongst the four of us to talk about how do you wrestle with some of the questions? What have we seen across our experiences around how organizations should wrestle with the question of how do I align my resources and my capacity with a demand picture that is evolving and changing and influenced by a number of factors. So I thought, Andy, I might turn the mic to you and ask what you've seen and what you're seeing in terms of best practices for how systems ought to be thinking about navigating this challenging issue.
Yeah, thanks, Andy. Well, let's start with just basically the volumes and or changes in the demand, both from an inpatient and outpatient perspective. You know, it's unreasonable, I think everybody would say that, you know, it's unreasonable to think that volumes and the mix will come back to their pre-COVID levels. Thus, you know, the expectation of your resource utilization or consumption of those materials or labor or equipment uses that were pre-COVID are going to return to the levels that they were in the past. You know, what is that new norm going to be? I mean, that's the big challenge, right? Nobody really knows. You only know about your own environment, how you're being impacted. But the key is, how do you now refit your organization, your operating environment, your resource loading, your material consumption to what that new norm is, and keeping in mind that form follows function, particularly with a lot of the things that Andy was talking about around telehealth, you know, medically home, et cetera. And we'll get into a little bit of that here in a bit. As I'm sure many of you attendees can attest to, you know, the dynamics, the impact of the crisis have been significant and varied. You know, there's been many organizations that have seen volumes and their inpatient and outpatient space drop by, you know, overnight, decline by 50, 60, 70%. You know, the question is, does that now return or not? And to what degree does it return? You know, much of this can be attributed to the fear, you know, of individuals not wanting to, you know, get out into the communities or come to get care because of the fear of catching the virus. There's consumer preferences, there's deferrals of electives, whether that's just the personal decision to refer, whether it's the organization's decision to defer, or even state or local mandates that you're going to defer those electives. There's the canceling of appointments, there's a lack of resources, you know, such as beds or PPE that limit or prevent you from perhaps doing some of the cases that you otherwise might, as well as, you know, do you have the skilled labor to actually perform that care and deliver that care? I mean, there's a lot of factors at play here. The impact on each market, geography, and the organization will be different. Everybody has a different environment that they're working in. So what organization A does not necessarily mean it's appropriate for organization B. The recovery and the demand patterns that will come back will be different than capacity challenges that need to be addressed and looked at. We're going to require different responses. So, you know, from my perspective, and I think, you know, you all would probably agree, is how well an organization recovers and transforms will be based on the data and the information that you have, the dashboards you're using that help you make better and informed decisions and respond quickly to the changes in the demand patterns that you're experiencing. Regardless of the situation, you know, you're going to have to use the data. You know, you've got predictive data, which maybe you have some insights or perspective on your individual market or organization on where things are leading to. You've got historical data you can refer to. That could be historical data relevant to, you know, the mix. It could be the number of outpatients that translate into inpatients. It could be, you know, time of day, day of week, month, seasonality, et cetera, as well as, you know, what's prescriptive. You know, how can you use prescriptive, meaning how can I control the volume? What volume do you want to have come back, and where do you want to have it come back? Do you want to do all your procedures the same way you did before? Do you want certain procedures to come back first because maybe they have better margins than others, or maybe you have the supply chain is more stable in that area or not? There's a lot of factors that need to be evaluated on you, and you really need to look at the data to help inform those decisions and enable the organization. The key is being agile, responsive, and flexible to respond as necessary, and that's going to take the data and the information. It's not going to be perfect. You're not going to get everything, you're not going to get 100% score on everything. You're going to have to learn and respond, and that's keeping those open lines of communication and really interpreting what's happening on the fly. There will be, for instance, labor is typically a big issue right now. Obviously, it's a large expense. It typically takes up 50 to 60% of an organization's expense. Understanding the volume and the mix, where it's happening, where that volume is coming back, how care is going to be delivered, not necessarily the same, right? Because if you moved the dial and started transitioning into more telehealth, you got more remote work being done. That needs to factor into what your staffing and your resourcing model will look like in the future. You can't just say, because I had X in the past, I'm going to have X in the Y, and this is how I'm going to deploy and how I'm going to staff. You have to adjust based on what that new future looks like. You're going to need to re-engineer and optimize. It may be, this is an opportunity really for everyone to really kind of reevaluate where they've been. They may have had ideas and thoughts about where they want to take the organization. They want to make shifts. Maybe they want to impact their cost structure from a labor standpoint. They've been limited in their ability to do so. These are some of those bold opportunities that you're going to have, and that we'll talk about in a little bit, to really make changes that are going to create step functions and not incremental functions in your operating environment. So what is that new norm? What are the strategies you need to incorporate to change in light of these consumer demands, the operational changes that are moving in certain directions, certain functions? For instance, like we said, remote and telecommuting models. How much of that are you using? How much is going to remain in the future? Do you want to keep those telecommute functions? And if so, are they with the same level and type of resources, or do you need something different? Have you found opportunities to automate, to apply automation that maybe allows you to repurpose those resources or those hours to some other activity that's more directly patient care given, or a need for the organization? How are you using your digital strategies, your virtual visits and care at home strategies to help drive the organization in a different direction perhaps than they were in the past, or to accelerate that move if that is where you're going, right? And that's going to take the data and the analysis and really the rolling up your sleeves and to really think through the permutations of what's really going on. There's going to be impacts due to the regulatory and legislative changes. I know Diane will talk about that in the peri-op space. What are the restrictions that those regs and or the legislation has put on your organization, capping capacity? Do you hold that capacity open? Are you resourcing that capacity or not? That's all factoring into your cost structure. So those are going to be limitations. How are PPE and availability of the PPE and or equipment going to limit what cases you can do and can't do? How much have you worked through, or how are you working through the domino effect? You have A, but you don't have B, can you do C? There's a lot of that, and data will help inform those decisions and allow you to make better informed decisions in the long run. How are furloughs? A lot of organizations, as we've all read in the paper and seen, have dealt with the issues of these declining volumes and trying to deal with their cost structures accordingly. And they've implemented furloughs. Some have unfortunately implemented reductions in force or pay cuts, etc. Well, now on the flip side, as the volume starts returning, what is your strategy now for bringing those employees back? Everyone has got a different strategy to deploy to furlough. A furlough is not a furlough is not a furlough. Some have furloughed 1 day, 2 days, weeks, months, whatever. Now, as they return to work, you don't want to necessarily bring everybody back all at once, right? You want to mirror your volume return in the mix and refit your staffing levels to that new operating environment and new volume. Right? Take the opportunity. Otherwise, you're really not capitalizing on the benefit or maximizing that benefit that you were trying to gain through exercising those initiatives to begin with. Okay. So, those are just some things I think from a volume standpoint. They're all interrelated. It's not a simple answer, but certainly there are things that need to be comprehended as you start digging your way out of this challenging period.
Thanks, Andy. Diane, I'm wondering, as you take some of the core themes that Andy just hit on, right, that volume isn't going to come back to what we thought it was. It's either going to be less or more. The idea that, I've got to have data. It won't be perfect, but I've got to have the best data I possibly can to figure out what's going on in my unique market environment. And then the notion of form following function, right, and using multiple levers to be able to affect that. Curious what you're seeing specifically in the surgical and procedural areas. What are the challenges that people are wrestling with, and what's some of the advice you would have for them on how to deal with some of these issues?
Certainly. Thanks, Andy. I think to align with Andy Schramm's comment about making sure that you use data, it's very important to have data and tools to drive your decisions. Many states have specific requirements that we have to follow to resume surgery and outpatient procedures. It's a very dynamic regulatory environment out there. I'll give you an example of that. In Illinois, the Illinois Department of Public Health allowed elective surgery and procedures to resume on May the 11th, but they have requirements that you have to have 20% of your ICU beds, 20% of your med-surg beds, your ventilators have to be available on a daily basis before you can resume the cases. You also have to have adequate PPE, as Andy mentioned, and you have to be guaranteeing that you're not staffing in a crisis mode. So we were able to help the organization build dashboards so that they could frequently throughout the day pull in that information. What's their staffing to capacity? How many beds do they have available? What's their PPE status? What's their pharmacy status? What's their blood status? And it's been a very valuable tool to help guide their care delivery and guide how they ramp up in their surgery and outpatient areas. The complexities are incredible to organizational recovery. I think in order to be effective, to reposition, to redesign, and to succeed in the new normal amidst these many pressures, you really have to have a strong organizational recovery plan. And many of those plans, we had to put in place and implement rapidly. We've had to develop rapid protocols and workflow changes. How do you get your point of care testing done? How do you social distance your patients coming in? How do you social distance for your providers? In the OR, we all know that the surgeons and anesthesia like to kind of congregate in that PACU area or in the pre-op area while they're waiting for patients to get ready or to discharge them. No longer can we do that. We have to really figure out what that plan is. We know that the surge, the volumes are all over the place. We've seen organizations begin to plateau and then their volume started back up. With all the current situation that's going on, we anticipate those numbers will go up and volumes will go up again. So we have to be able to be nimble and flexible and adapt accordingly. I think the other thing that's really important is, interdepartmental coordination. It's really important to put in place a huddle. That's a multidisciplinary huddle where you can have frequent discussions throughout the day. What is the current status of the organization and what can we manage as far as ramping up? I think if we look on the next slide at some of the key stakeholder roles in prioritization and OR scheduling, I think if we could back up, I think there was another slide in there. We could, okay. Well, that's fine. You can move to 19. I think what's really important is that we know that many ORs in overnight in many instances became ICUs, or equipment was borrowed from the ORs where it was used into the inpatient chassis. So anesthesia machines, monitors, and so forth. It's going to be really important that We make sure that the operating room and the procedural room spaces are ready to receive patients. Have they been disinfected? Is your equipment all there? Do you have the right air exchange? Many of your staff have been pulled away. So have you been able to call your staff back? It's also, I think that resources, as we mentioned, are in a very critical status. Personal protective equipment, your blood, as I mentioned, your pharmacy, point of care testing supplies are a real challenge as well. So it's important that we put together in the recovery process a committee. And that committee should have representation from physicians, from nursing, from your executives, you know, your operating room director, your procedural area director, key physician chairs or chiefs of their service line, making sure that they put in place a prioritization tool. And this is another requirement that is recommended from American College of Surgeons, from AORN, from anesthesia governing bodies, is that in order to determine what's the prioritization of your patients coming back, how do you ramp back up, you need to put a scoring mechanism in place. One of the recommendations for that was the Unce tool. But you can develop your own scoring guideline using some of the other practices used elsewhere. With the organization we are working with in Illinois, we took some components of the Unce tool as well as what was being used in Italy and France and developed a prioritization criteria. And so that we can go through that backlog list and identify which cases are we're going to start first. Certainly understanding those resource limitations, as Andy said, it's going to fluctuate on a day-to-day basis depending on your surge volume, depending on what your PPE availability is. You know, we know that there were issues with medications during the impact of the initial crisis. So it's making sure that you're looking at that, using that dashboard to guide those decisions as to what volume you can ramp up. The other thing is it's important to understand, you know, what's the appropriate location for the surgery, outpatient versus inpatient. Obviously your inpatient cases are going to consume more resources, especially from a staff bed perspective. You might be able to ramp up some of that backlog of cases that were more outpatient related. This particular organization we're working with did not have an ambulatory surgery center. So we had to figure out how do we prioritize and how do we balance those inpatient and outpatient cases in the ramp up. Hopefully you all were able to maintain a list of canceled cases, but many organizations have not. So it's working with your scheduling department, with your clinics to understand what that list is. And that's been an evolving list as we move through the last few months of this issue. I mentioned making sure that you have that huddle. In the OR, we do a daily huddle. We pull in and invite, as I said, multidisciplinary, but we invite the leadership from the procedural areas such as interventional radiology, cath lab, GI, endoscopy, and we walk through that dashboard and we talk about, okay, how many beds are needed for the schedule for the rest of the week, and how are we going to be able to manage that? What do our resource needs look like, and what's the current situation? It's important to ramp up a call center. Obviously, a lot of calls to be made. You've got patients who are very anxious, they're fearful. They're not sure if they want to come back, they want to have their procedure. So it's making sure that you've got scripting with that call center so that you're communicating and trying to alleviate that anxiety. In many instances, we're seeing the surgeons and the proceduralists call their patients as well, and just to try to alleviate some of their anxiety. The other point here is you've got to do your pre-anesthesia testing and your education, your evaluation, and many of that type of PAT process is being completed by telemedicine and only requiring the patient to come in when they need to be seen by an anesthesiologist in person. Hopefully it can be done over telemedicine. And I think, certainly involving the clinics, Annie will get into the ambulatory clinics area, but is certainly working very closely with that and being aligned as well. And then lastly, as we think about, I mentioned patient communication, it's just really, really important to reassure the patients that we're ready for them, we've taken the precautions, explain to them what the process will be when they come into the organization. They need reassurance about the point of care testing, about social distancing. It's difficult for them to understand visitor limitations and try to help them understand that. Also, just as important for reassurance for your staff and education of your staff and the surgeons as well. We can go on to the next slide.
So I think what might be interesting, Annie, we've hit on your world a couple of different times here. We talk about shifting volumes, responding to changing consumer behavior, the acceleration of telehealth and alternative sites of care. Wondering if you have advice and thoughts on just how people ought to be thinking about navigating all this complexity in the context of we've got shifting consumer behavior, which is then influencing different demand for services and site of service.
Yeah, thanks, Andy. So, I mean, much as has been said so far, and as I know, we all know from what's happening at our organizations, the focus for many health systems and community providers right now really is on ramping up the elective volumes and ensuring that that backlog of referrals and canceled clinic appointments from March, April, and into May are scheduled or rescheduled as soon as possible. I really liked the comment from a participant earlier. Larry Tracy said that his organization is tripling down on outpatient access, and that is so true. I mean, many organizations are putting the full force of their effort behind bringing ambulatory back up as quickly as possible. So a lot of the organizations that we're partnering with or talking to about COVID response and recovery began reopening their clinics for non-emergent elective services in the last 1 to 2 weeks, or in some of the areas that were more greatly impacted by COVID are looking to initiate those clinic visits and services for the treatments and services that could fall into the CMS tiers 3 and 2 as outlined in the CMS framework within the next week or so. So we've already touched on some of the influencers of capacity at an organizational level, the regulatory restrictions, PPE, blood supply, bed availability, et cetera. And so I thought I'd spend just a couple minutes on 3 more operationally focused recommendations that we have as you and your teams begin to address capacity and demand at a clinic level. So recommendation number 1 is to develop a clinic expansion workbook. The first part of this is going to sound extremely basic, and it is, but it's foundational and it can be built upon as you not only recover, but reposition and redesign. So this clinic expansion workbook, keep saying it, is essentially an Excel workbook, or you can utilize available reporting or data that you have in your BI system to understand your total anticipated weekly demand by clinic and align it with your total capacity based on appointment slots on your clinic scheduling templates. Having this data on hand will enable your organization to understand what a ramp-up schedule could look like, and also allow you to break the data down, tease it apart in a few ways, such as coordinating with clinic leadership to apply tiers across your projected in-person demand, and then also taking a deeper level or a deeper look at the data to give you a sense of what your projected telehealth demand is or could look like week over week as you continue to recover. And once you have that data set up, it can be really helpful to reconcile it with the projected organizational resources that were discussed earlier, such as testing capacity, PPE, et cetera. Maintaining this workbook will allow you to understand if you're seeing ramp up in the ways that you expected as an organization, or if there are any points in time that you need to adjust your anticipated volumes week over week to account for organizational constraints. So, I mean, for example, at one organization, they prioritized the reopening of their ORs back in early May. They're 3.5 weeks in now, and they're actually exceeding 100% of their pre-COVID surgical levels for this time last year. That is great. It is meeting a patient need. It's satisfying the surgeons at the organization. However, as the clinics in the organization are now preparing to begin to see their tier 2 and tier 1 patients, there is a concern that there isn't going to be enough PPE on hand to sustain both the 100% of surgical volumes and ramp up ambulatory to 75 or 100%. So maintaining a clinic expansion workbook will allow you to keep track of that and push your recovery a few months down the road. To supplement that, suggestion number 2 is to also create an ambulatory recovery playbook. This can be your one-stop shop guide and a checklist for clinic directors and managers that can be helpful, can provide some helpful information on categories such as facilities, supplies, equipment, workforce considerations, updated workflows, and access to, as Diane mentioned earlier, that really important organizationally approved patient communication examples that can be used at both a clinic and a provider level. And then recommendation number 3 is for organizations that have contact centers in place for appointment scheduling and pre-service functions, ensure your contact center leadership, I know it's going to sound like a no-brainer, but it's important. Ensure your contact center leadership have been included in your clinic director, clinic manager, ambulatory meetings, ambulatory planning meetings to understand the anticipated reopening plan. One organization that we've spoken with opened up their clinics to all tiers, tier 3 to 1 patients at the same time. They were comfortable with their PPE days on hand and testing capacity. Their in-house COVID volume was down. So they sent out patient communication saying they were open and ready to care for their patient population. This was a couple weeks ago. They had a positive response to their communication efforts last week, but experienced a surge in call volume into their now remote contact center that the organization wasn't quite ready to handle. There was a significant impact to call wait times and handle times, and there is some concern that as a result of that, the organization may have experienced some leakage in the 2 days that it took to reroute calls to clinics to have them assist with scheduling. So those are a few recommendations as you look to get your ambulatory clinics back up and running, and we can touch on telehealth next. Andy, do you want me to go right into telehealth?
Keep rolling. It's great.
Okay, here we go. Okay, so as you have all mentioned in your responses to the first question, telehealth has become such a focus for so many organizations. And so we just wanted to spend a minute on how we do see the role of telehealth evolving and a few technical and operational considerations for telehealth. So, I mean, really the COVID situation, as we all know, has been unthinkable on so many levels, but as Andy said earlier, telehealth really is a silver lining in this situation. And I have to say, it's been really just impressive and inspiring to see how quickly and collaboratively so many organizations have responded to patient needs and safety by standing up telehealth technologies and workflows seemingly overnight. Pre-COVID, Huron was having frequent conversations with organizations who were interested in getting more virtually connected with patients. And most at that point were thinking about telehealth as a piece of a longer-term digital health strategy. But now all of that has been accelerated. Some organizations are standing up telehealth for the first time. Others are extending it into specialty care for the first time. And we're seeing a variety of platforms and workflows develop out of this need. This is a subject that we could talk at length on, and I believe we actually will be during a Huron telehealth workshop on June 10th. But we're seeing a lot of early lessons come out of these quick implementations that have occurred over the last few months, so I thought I would hit on just a few of them. The first 2 items I'm going to mention have to do with telehealth and scheduling tools. So as we look, number one, as we look to set up telehealth and tie it to scheduling, it's a good time to make sure that your telehealth is incorporated into your existing scheduling tools, such as scheduling questionnaires, protocols, decision trees. We are seeing it be separate for a lot of organizations, which is understandable given how quick some of this needed to get set up. But you do want to make sure your telehealth and scheduling platforms are integrated, because doing so will ensure that you're able to take advantage of those tools like questionnaires and protocols to ensure that telehealth is systematically offered by your scheduling teams at the time of scheduling. It becomes a part of their script. Number two, also tool related, is to determine the best approach for telehealth as it relates to your clinic scheduling templates. We're seeing some organizations that originally established telehealth blocks on their templates that are now undoing and redoing their telehealth designs to orient telehealth instead around tools like session limits to avoid underutilization of those blocks and increase overall template utilization and schedule utilization. Item 3 has to do with reviewing the types of patient populations that are seen via telehealth. And this is an exciting conversation that is happening, I know, across the country, but really let's use telehealth as an opportunity to attract and retain new patients. Currently, many organizations are not equipped to see new patients via telehealth, or even existing patients from within the network who don't have an active account with your organization's patient portal. In the longer term, there's an opportunity to perhaps approach for primary care, for example, telehealth is an option for new patients and patients who don't have an active account with your patient portal. And then item 4, I mean, this is the big question on the table and is the one that I think is being addressed everywhere at this point, is what is this going to look like going forward? What is that distribution of telehealth and in-person volume going to look like as we step out of COVID and enter this new normal? That's a discussion that is happening everywhere. We don't have the answer yet, but what we do know is it will be different. That distribution will be redefined. And so making sure that your organization is in a good place to be flexible and nimble and address those changes as they come is going to be important. And I will pause there, Andy.
That's great. Diane, one of the areas that's been interesting in virtual and telehealth is the movement towards acute care in the home. And you're seeing people like Adventist partnering with Medically Home and others. I'm curious if you wanted to offer a couple thoughts on why do we see systems moving in this direction? What are some of the associated benefits of making a move like that? And Diane, I think you're on mute.
I was
there you go.
mute. Thanks, Andy. Yes, we are seeing a shift into the post-acute home setting. I think, certainly one of the benefits for that has to do with, patient experience, right? In a COVID situation, the patient doesn't have to come to the hospital. They don't have to come to the ER. We can monitor them, take care of them in their home environment. Also, they've got their family support. If they're in the hospital, they're not going to have any family visitors there for them. I think the other benefit as well is helping to manage, the inpatient operational piece of this. Capacity constraints are an issue as we see surges. We often do not have a place for the patient to go to discharge them from the ICU, or we don't have a place for them to go when we discharge them from the medical units, step-down units. So having that opportunity that they could be discharged to home and have their care there has certainly helped to manage that capacity. I think the other thing related to that is during the initial COVID crisis, especially as we saw nursing home being high-risk areas, many of the SNF units were closed to accepting new patients. So it really provided that other option for discharge.
Gotcha. And Andy, certainly models like hospital at home place pretty substantial stress on an organization, but quite frankly, all of this, as you said, form follows function, places huge stress on the organization. And, particularly when you have things that might happen like in Massachusetts where you might be required to keep 20% of your capacity available at all times to deal with COVID inflow. I'm curious, as you think about longer term resiliency, what are some of the workforce and people implications? How do you navigate all of these challenges?
Yeah, so that's a good one, Andy. I think it's the resiliency and the sustainability.
Simple question to
right?
answer,
How do you
right?
do that? I think all organizations, at this particular juncture, and I mean, like we said earlier, nobody really knows what the answer is. And I think the open communication, leaders being clear about expectations, they may not have all the answers, but being clear with that communication, being forthright, engaging not only their staff, but also their patients. Get the feedback, create the feedback loops and communicate clearly and succinctly. If you don't know, say you don't know, but you'll find out the answer, but continually responding to those concerns and questions that everybody has in this time of crisis is going to be important, right? I mean, it's the Winston Churchill thing, right? There's don't let a good crisis go to waste. Well, how do you use this crisis to actually leap in,
Right.
take step improvements? So I think that's really a key component of it. There's opportunity in this. And I think it's seeking that out and using all the information, that's at your disposal, and really thinking about what you want to look like as you come out the back end of this crisis, as far as making sure you've got an engaged set of resources, you've got the right operating environment and structure to be able to be successful in not only the short term, but also mid and long term. Mm-hmm. And people are going to be the answer.
And as you talk about, don't waste the crisis and take advantage of the opportunity, I thought it might be fun for each of us to share a view on what we think what bold moves folks ought to consider. And maybe I'll lead us off. I think there's kind of two, just looking at the thoughts on recovery, it's really hard to miss the fact that consumer as a capability becomes really important, right? It's the key to navigating uncertainty is having a perspective around what's driving changes in behavior, be it your internal associates, colleagues, or your end customers. It feels like now is the opportunity for the industry to really accelerate the move towards consumer. And secondly, given that we are all being asked to do more with less, it also feels like an opportunity to reinvigorate the conversation around systemness. And so we just don't have the luxury of some of the inefficiencies that might result. And so it feels like pushing on systemness as well is one of the bold moves folks ought to be considering. Annie, do you want to share your thoughts on bold moves?
Yeah, sure. I think to tie into that, Andy, it's such a good point. I would love to see the momentum that we have behind telehealth right now also being extended into other digital strategies for patient care. So making sure we're tying the digital experience with service line and care delivery models, looking at things not just like telehealth, but also incorporating CRM into our platforms and telephony that integrates with the EMRs. I think let's use this time to bring all of those together and create a digital strategy.
Terrific. Diane, how about your bold move?
Sure. I mean, I think that a bold move certainly could be to partner with other organizations, whether that be to manage your PPE inventory, or how do you work with other organizations? As we know, there have been variable impacts from a geography perspective related to COVID surges. So, you may need to partner with another organization. For example, a hospital had to close their pediatric unit and partnered with a larger children's hospital in the area to help manage those pediatric patients during the surge, but also during the ramp up process.
Cool. Andy.
Yeah, I think mine would be, take the bold move. Don't expect that you have to have your environment the same way it was pre-crisis. Be bold and look for operations that are going to be more efficient and effective in delivering the care the way you want, and then fit your resources to that new model. Don't feel it just because you've, perhaps furloughed 1,000 employees that you have to bring them all 5,000 employees back. It could be that you only have to bring back 500 of them, or maybe you got to bring back 1,000 plus another 200 based on the new operating environment. You really need to be
Right.
bold about what that new environment's going to look like and adapt accordingly.
Terrific. Well, Jennifer, we'll pass it back to you.
Thanks, Andy. I know we're running a little tight on time, but I do want to take a moment to ask one question, and Andy Waldeck, I'll maybe ask you to start us off here. So for the leaders, particularly all the leaders we had join us from various organizations on this call, how do leaders need to act differently to move their organizations from status quo to really creatively transforming, given everything that's happened in this industry?
I'm going to pick up on the theme that Andy left with, right? This is an opportunity to think and to act bold. That doesn't mean by any stretch of the imagination we should take on greater risks than we need, but it really is about encouraging your teammates and your colleagues to think bold and to challenge their pre-existing orthodoxies, right? In the end, modeling behavior as a leader is one of the best mechanisms and most effective to ensure that that takes hold inside of your organization. So you may choose in the end not to execute on a bold move, but you certainly should have the conversation, and you certainly should examine all of your pre-existing assumptions about the nature of your market, competition, who you are, and most importantly, what the formula will be for sustainable long-term success.
Thanks, Andy. So I want to be respectful of everyone's time. We will go ahead and wrap up. You will receive a recording and some additional insights from us in the next couple of days following this webinar. So if you have additional questions or we didn't get to a question today and you would like to reach back out, you will definitely have that opportunity to do so. So just want to end with a thank you for all of you have done through the last couple months, all the service you have provided to patients and to the communities you live and work in. We are really humbled and honored to work with healthcare at this time. So thank you all for your time and look forward to opportunity to connect in the future.